If you suffer from ongoing chronic lower back pain, you're not alone. I see tons of patients every day that comes and complains to me, "Doc, I can't sit for even 15 minutes, and after I sit for too long, I stand up, I can't straighten my back." Or I wake up in the morning and I can't stand straight, and it takes about 5 minutes for my back to loosen up before I feel alright. And another one, which is a very common complaint, "Doc, I've got back pain that shoots and radiates down my legs." My name is Dr. Nicholas Chua. I'm the Medical Director and Pain Physician in Specialist Pain International Clinic. Today, we're going to talk about some of the causes of lower back pain and more specifically what you can do about it. Now, lower back pain, like neck pain, can be divided into two general classes. The first class is pain that is mainly in the lower back alone. The second is pain that radiates down the legs. I'd like to talk a little bit about pain that is only in the lower back, and that's what affects most of you. Now, lower back pain can sometimes come from the disc, the intervertebral disc that undergoes all the stress of your daily life, including walking, standing, sitting. These discs degenerate, they lose hydration, they lose fluid over time, and they get drier, more desiccated, and because of that, they can crack. Some of these cracks will end up becoming chronic. We call them annular tears or chronic discogenic back pain. This is the typical type of patient that tells you, "Doc, I can't sit straight, I can't sit for 15 minutes without moving my back, otherwise it gets very, very, very achy. And I can't stand up straight whenever I sit for too long." Some of these patients are young, they can't even sit through a movie or a meeting. This affects your quality of life, your daily function, and maybe your job prospects. So one of the best self-help techniques that you can adopt if you do suffer from chronic discogenic back pain is actually core strengthening. Many of you don't understand what core strengthening is all about. What is your core muscles? Your core muscles are actually your antagonistic muscles that support your spine. Antagonistic means front and back of the spine. The back of your spine are all your lower back muscles, and the front of your spines are actually your flexor muscles. Now, when they contract simultaneously, that constitutes core muscle strengthening. So to do core muscle strengthening, your lower back and your abdominal muscles or your flexor muscles should be in contraction at the simultaneous point of time. One of the easiest exercises that you can adopt or learn or master is actually planking. Planking, there are many variations, and to do a plank well, your core muscles has to be strong. This is one way that you can help rid yourself of your chronic lower back pain. The more your back hurts, the less you should rest and the more you should plank. Now, if you plank, if you do your core activities and you do your core strengthening and you still hurt, it's time to see a pain specialist who will order an MRI for you to see the degree of degeneration and to see whether there are certain discs or structures that needs to be treated. This treatment can range from the short course of medications to injections like epidurals or targeted nerve root injections, or even procedures targeting the disc and the tear in the disc known as annuloplasty. Now, it can sometimes be a bit more worrying when you have back pain that actually radiates down your buttocks and very commonly to the sides of your calves. Now, you know that you have a pinched nerve when you can't raise your leg in a straight fashion. That's known as a straight leg test. And it's very commonly done when you come and see your doctor, and he will perform a straight leg test for you to see whether your nerve is under tension or is pinched. An MRI would then confirm which level. You know that there are 5 levels in the lumbar spine, which level is actually causing the pinched nerve, and your doctor will then suggest treatment that is appropriate. Now, 70% of all pinched nerve situations is treated by physiotherapy and conservative measures. Most of the time, this will resolve and the patients will end up feeling better. However, if it becomes chronic and you're now unable to walk very far or even take a step without feeling that sharp shooting pain down the sides of your calves, this will then require a little bit more help. Specialized medications that targets the sensitivity of the nerves can be given, and these coupled with anti-inflammatory medications like NSAIDs, which are non-steroidal anti-inflammatory medications, or more, or even better, COX-2 inhibitors, which spare the gastric lining from the side effects of NSAIDs. These will often result in a better degree of pain relief. When this is still not good enough, targeted procedures that deliver medications such as steroids directly to the pinched nerve will reduce inflammation and swelling of those nerves. Now, imagine if you have a nerve that is currently pinched on, that nerve will get swollen. With the swelling, it complicates and it compounds the problem even more, resulting in a tighter space for the nerve to travel. That steroids delivered directly to where the swollen nerve is will now reduce the swelling and allow that nerve root to move, to glide a little bit more freely, thereby relieving the nerve root pain. Chronic lower back pain can affect your quality of life. It can affect your daily function. Can you imagine not being able to run for that bus or chase after that MRT train? You will have your quality of life affected if you don't get this sorted out. We have taught you ways to manage it yourself. However, if that fails, it's time to actually see your doctor to find out whether there is something that can be addressed in a more definitive fashion.